Today, we need to talk about something that affects countless lives, the connection between drug addiction and mental health. This isn't just a medical issue, it's a human one, impacting families and communities everywhere. Addiction is not a moral failing or a sign of weakness, it's a complex brain disease that changes how people think, feel, and act. Mental health disorders like depression and anxiety are real medical conditions, not something you can just snap out of. When addiction and mental illness collide, the result can be overwhelming and isolating. For too long we've treated these as separate problems, sending people to different specialists and missing the bigger picture. The truth is, these issues are deeply intertwined. You can't treat one without addressing the other. To help someone truly recover, we must look at the whole person. This integrated approach is the foundation of effective treatment. Whether you're struggling yourself or supporting someone who is, understanding this connection is the first step. This isn't about blame or judgment, it's about empathy and knowledge. Recovery is possible, but it starts with honest conversation. Let's bring this topic into the light because lives depend on it. The journey to healing begins with understanding. Let's take that first step together. To understand the link between addiction and mental health, we need to look at the brain's reward system. Normally, dopamine is released when we do things that help us survive, like eating or socializing, making us want to repeat those actions. Drugs hijack this system, flooding the brain with dopamine and creating intense euphoria. The brain starts to crave the drug above all else, sidelining natural rewards like food or relationships. Over time, the brain adapts by producing less dopamine and reducing its receptors, making it harder to feel pleasure from anything but the drug. This leads to a state called anhedonia, feeling empty and lifeless without the substance. At this point, using the drug isn't about feeling good anymore, it's about feeling normal. Addiction fundamentally changes the brain's wiring, especially in areas responsible for decision-making and impulse control. It's no longer about willpower. The brain is now hardwired to seek the drug, despite the consequences. This is why addiction is a chronic brain disease, not a character flaw. Understanding this helps us replace judgment with compassion. Recovery requires medical and psychological intervention, not just trying harder. The more we know about the brain, the better we can support those in need. Addiction is treatable, but it takes time and the right approach. Let's keep this science in mind as we move forward. Substance abuse disrupts brain chemistry, making mental health disorders like depression and anxiety more likely. Depression can set in as dopamine levels drop, leaving people feeling hopeless and trapped. Many use substances to self-medicate anxiety, but this often worsens the problem over time. Some drugs can even trigger psychosis, hallucinations, paranoia, or delusions, especially in vulnerable individuals. Long-term use can damage memory, attention, and problem-solving skills, making recovery even harder. These mental health challenges are not just side effects, they're part of the same struggle. Recognizing this overlap is crucial for effective treatment. When addiction and mental illness occur together, it's called dual diagnosis, and it's more common than you might think. These conditions create a vicious cycle. Mental health symptoms drive substance use, and substance use worsens mental health. For example, someone with depression might use stimulants for relief, only to crash harder when the drug wears off. Or a person with anxiety might drink to feel comfortable, but alcohol ultimately increases their anxiety. The substance becomes both the solution and the cause, trapping people in a self-perpetuating loop. This constant crisis makes it hard to think clearly or stick to treatment. Relationships suffer, and isolation grows. Breaking the cycle requires treating both issues at the same time. Ignoring one only fuels the other. Recovery is possible, but only with a strategy that addresses both conditions together. Dual diagnosis is not a rare exception. It's the reality for many. Understanding this cycle is the first step to breaking it. Integrated care is the way out. Treating addiction without addressing mental health, or vice versa, sets people up for relapse and disappointment. If someone leaves rehab with untreated depression or anxiety, they're likely to return to substances for relief. Likewise, therapy for mental illness won't work if substance use continues to cloud the mind. The only effective solution is integrated treatment, addressing both addiction and mental health together, often with the same team. This approach allows for a complete understanding of how each condition affects the other. It's the foundation of dual diagnosis care. Integrated treatment gives people the tools to manage symptoms and cravings at the same time. As sobriety grows, mental health often improves, and vice versa. This synergy is where real, lasting recovery begins. Healing happens when both sides of the problem are treated together. What does integrated treatment look like? It starts with a specialized dual diagnosis program. These centers offer coordinated care from therapists and psychiatrists trained in both addiction and mental health. Medically supervised detox is followed by therapy like CBT or DBT to address thought patterns and teach coping skills. Trauma-focused therapies such as EMDR can help heal deep wounds. Medications may be used to stabilize mood or reduce cravings, but must be managed carefully. Support groups like AA, NA, or dual diagnosis groups provide community and understanding. Building healthy habits, exercise, nutrition, sleep supports brain and emotional healing. Recovery is about more than stopping substance use. It's about building a new, healthier life. A strong support system is essential. Every step forward counts. If you see yourself or someone you love in this story, know this. There is hope. You are not alone. Millions have faced these struggles and found recovery. The journey is hard, but every small step toward help is a victory. Reaching out is an act of courage and the first step to a new future. Healing is about more than quitting a substance. It's about rediscovering yourself and rebuilding your life. Be patient and kind to yourself. Transformation takes time. Support is out there. Doctors, therapists, support groups, and helplines are ready to help. Addiction and mental illness are treatable. You are not a bad person. You are someone who deserves to get well. A meaningful, joyful life is possible on the other side of this struggle. Believe in your capacity to heal. Take that first step today. You are not alone, and recovery is within reach. Follow us on TikTok at Recovery Journey 33, Instagram at Recovery Journey 33, and Recovery Journey on Rumble for more contents like this. See you on the next one.